7 webinars that we've got planned over the next few months, where we are going to focus on lots of different things to help clinical or health and care leaders out there to work out ways that we can enable research to become part of standard practice. So there's lots of resources out there that we're going to give you over the next 7 months. So my name's Nichola Verstraelen. I am sort of leading on this project and leading on the Matrons and Health and Care Leaders Research Toolkit, which is to be published soon, probably in April time. And I'm joined here today by Claire Gabriel and Nick Manning, who are both senior research leaders supporting improving the culture of research across the NHS. And we've got a number of community of practice research leaders in the background as well, but Nick and Claire are going to be doing our presentations. And then we're joined, I'm really looking forward to this presentation by Charlotte and Sharron, who are clinical staff working within renal services and are research champions. So we're going to hear from them today as well. So Declan, could you just move on to the next slide? So I suppose I've just given you an overview of what our agenda is really, but we're going to spend the first half an hour presenting about research delivery champions, and we're going to hear from the champions, and then the last half an hour we're going to use it as an opportunity to speak to each other about how we potentially might think about setting up some of these champions within the service that we run, and what might be some of the barriers and solutions to that. So the first half an hour is recorded, and we will be popping that in a website and send out in emails as well. And then the last half an hour we'll just be getting the feedback from people. So just want to move on to the next slide. So I'm not going to move forward until saying that this is the start of the future, and this is we are now part of a community of practice, and to support that we have set up a Futures NHS webpage, where there's lots and lots of different resources that have been co-created by matrons and health and care leaders, as well as research staff, amongst the whole trajectory of research, and you can click into each of these and see examples of how other organisations or other members have done work around all of these topics. So we will send out the link to that, and you can feel free to have a look at those at your leisure, and then feed into the communication and comms, so that we can learn from each other, because this is our community practice, where we want to hear what are those barriers, and we want to hear how people have got through that to be able to implement and enable research and innovation to happen in their organisation. So that Futures NHS web space is for us. Want to just move on to the next slide, please? So our title of the webinar today is Link Staff in the New Age, and we are focusing on particularly on research delivery. And what do we mean by that? So we're promoting research studies that are being set up or delivered within a service, or general promotion of research within the service. So that is opposed to any work around homegrown research, or using evidence to inform practice, or publishing research or focus group work or QI work. So I would say that's more the academic type research. So it's purely looking at, probably the majority of studies will be on the NIHR research portfolio. So you might think, well, we're not doing any research studies in my service, and that's okay. You know, we're here to promote what the champions can do to promote other things about getting people involved in research. Or you might say, well, actually, we're not doing any studies, so let's see if we can do a study. So it is around champion or ambassador roles. There's lots of different titles out there, but I think it is really useful to distinguish what areas of focus your champion or your ambassador is promoting, so that you can some combine both promoting academic and evidence-based practice and combine research delivery as well. But it's useful to know when you're having conversations with people about what is their area of focus. Next slide, please. Okay, so some of the definitions and roles. Sorry, I've just had a message to say, Chris, could you just go into the other meeting? Because I think there are still some people in the other meeting that haven't moved across. The link is in the chat there.
Declan, are you able to do that? Because I've tried and I can't seem to get through. Can you do that quickly? I will try and send
sharing the slides, so I don't think I'll be able to move across.
I will have another go.
It's all right. I'll give it a go. It's fine.
Thank you.
So what is a link or a research champion or an ambassador? So just looking at some of the definitions out there, it's obviously a link person, a coordinator between research and clinical or health and care practice. It's to increase that two-way communication. And these champions can be all grades or levels of staff from NHS or care, all demographics and roles. So we've got healthcare assistants, we've got nurses, we've got AHPs. It can be any profession. And I think the slides have gone now because Declan's left. So I'm sorry about that. Right.
Everyone is moving across. We put the link there, but everyone is moving across now.
Oh, sorry about this. We've only got an hour out of your day, and I'm trying to rush through this, so we've got enough time. Carl, do you think you'll be able to share the slides?
Quite possibly. Bear with me one tick.
Sorry, I realised I just killed the slides. Sorry.
You're back.
Oh, thank heavens, Declan's back.
We will get better at this, I promise. Okay, so yeah, it can be any profession within a service, and it is very important that this research champion or ambassador role is supported by either your research department or the clinical research network or somebody that understands research that can support the champions through that role. Just next slide, please. Okay, so we're very much linking this to the original reason why the toolkit was actually developed and designed itself through the Matrons handbook, which is obviously a handbook to enable and showcase to matrons and leaders how they can take forward their role as a matron. So we obviously research is within the Matrons handbook, and that is going to be going through some amendments at the moment. So hopefully that should be coming out soon, the new version of it. But this is really focusing on that clinical and health and care leaders perspective. So why is that important? Why is it important for matrons or health and care leaders to oversee the champion role? Well, we think it's important under the governance, patient safety and quality aspect of the Matrons handbook to provide assurance, oversight, supervision. How do you as a leader know that your champions are promoting research, or are they giving you the data to say, well, actually, we've actually in our ward environment or in our community environment, we've referred patients to the research team for studies, or is our research board up to date, or are we promoting this to staff so that when the CQC come in and that sort of thing. So we do think it is a really important role, as much as it's important to oversee what your infection control link nurses or link staff are doing. So it is linked to that side of things as well. Next slide, please. This is just a slide which many of you will have seen in the past, and it is one of our resources on that Futures NHS webpage. But it's just showcasing how a research champion or ambassador can have a research board in their area, and we've got QR codes on our boards which showcase exactly what studies are happening within that area, and it links to our accreditation scheme as well, where when the matrons audit our ward areas, they ask a number of questions about do you have a research champion, do you have a research board? And so obviously as leaders we need to ensure that that is happening within our service. So that's just an example of that in practice. Next slide. So I thought it'd be useful for the clinical and health and care leaders out there to have a think about, why do we as research staff want you guys to to know about research and having that champion as the intermediary between us. So obviously you as health and care and clinical staff know your patients better than us. You know, you're aware of what the latest treatments are and issues going on with the patients or clients, and you know, the champions can help bridge that gap between both the research side and the clinical side. You know, and the more studies that are happening in your area, the more access your patients to have extra staff to oversee the safety. So champions can help promote all of that. You know, thinking about what we would do, we screen, you know, lists of patients that are coming through clinics. We screen the wards, and you know, there's quite a lot of work that goes into that. So you know, getting referrals from the clinical side would really help enable more patients to be offered more studies. And you know, we want all clinical staff to understand how to get hold of the research team. Care is not separate from the research treatment. You know, it is all clinical or care treatment, and so documentation is really important about that. So you know, the champion's role is to picking up on these sorts of things. Well, we're not doing this quite right, and you know, it's a two-way communication, so we can improve that. And obviously, Claire's going to talk about CQC, but you know, your staff need to be ready for those CQC inspectors coming and asking staff, and even potentially patients, has research been offered to you, and what studies are happening in your area. So it is really helpful to have champions on board. Next slide. Claire, I'm going to hand over to you now.
Thanks, Nicola. Yeah, so as you alluded to on a few of the points there. So clinical research is now under the remit for CQ inspection. So it's under the well-led section. And also it forms part of the NHS Constitution pledge, and that patients should have the right to be informed of research that is eligible to them. So as we've already mentioned, this is how our champions can assist to ensure that we comply, and also to hopefully you know, improve our inspections and our ratings for the CQC as well. So it's sat there under the Learning Improvement and Innovation Quality Statement. You can see that there under the well-led section. Next slide, please, Declan. So here's some examples of some questions that the CQC may ask if they come into the clinical areas. I'm not going to go through them all because you can all read the slides, but just pick out a couple. So what do staff know or think about research at all levels? And the champions can help to engage the staff, and they can promote research. They can promote a positive research culture in their areas, so that the research is visible and it's also valued, so they can help staff understand the importance of research and how that links to their roles in everyday practice. Next slide, please, Declan. And just looking again, we'll go to the bottom question there. So how are patients and carers given the opportunity to participate in research? And the role the champions can have here is to inform the patients. They can inform them as they're admitted. They will know, because it's them that's giving the day-to-day care, whether or not they're eligible, whether trials will be suitable for them. So they can possibly promote and introduce clinical trials when patients get admitted to their areas. And as Nicola's also mentioned, it's keeping information boards up to date, making sure all the current research that's available to their patients is there for them to see. So giving them every chance really to engage with and participate in research, which is their right to do. And it would be, you know, we need to make sure that they're given these opportunities whenever possible. So I'm going to pass on now to Charlotte and Sharron, who will talk about their real life experiences of being champions, and also a manager who supports a research champion. Thank you. Next slide, please.
So if we go to Charlotte first, if that's okay, because we've got Charlotte's slide next, I think. Declan, if you want to just move on to... Yep. Charlotte.
Hi, you're right. So yeah, so as Nichola said, my name's Charlotte Hardacre, and I work as a staff nurse with renal home therapy. So I got into research following an apprenticeship, a self-chosen 4-month full-time apprenticeship when I was a student nurse last year, and absolutely I've always been into promoting about best care using best practice. So to actually see it from the other side, how patients get involved, was something that I really wanted to get involved with when I qualified. So when I qualified kind of beginning of last year, I became the research champion for my current team as soon as I started in post. So my role as a research champion includes that I actively link in with the renal research team, assign post patients from the unit. Because it's home therapy, it is quite a quick turnaround sometimes. So we do both peritoneal and hemodialysis training, which means that once they've done the training and they're competent, they go back home to do their own dialysis independently. And I promote the benefits of research in practice for staff and patients alike. I also am able to use my research champion role to link in with my additional roles in the team, which include being the link nurse for the community, because my background prior to qualifying, I was with district nurses for 10 years as a healthcare assistant and then a nurse associate. And I also work on the supportive care team, which is invaluable. One of the new studies coming through from our unit is about looking at including the elderly more into research and things, and just getting funding for that. So being able to link in with that with the consultants and be their link person is absolutely amazing as well. And so having the research participant means that I feel confident that I've got the knowledge and the understanding and appreciation to keep asking questions in practice and encourage other people to do the same, regardless whether our healthcare see a lot of people in the community, to encourage them to ask questions about practice, to feed that back into to kind of signpost them to studies, or to speak with the research team as well. And I've found that being that staff member who's passionate about promoting research encourages others to want to engage and support, and as well the opportunities it opens to work with a wider MDT from the research nurses, consultants, and developing those skills is absolutely fantastic. I think the one thing from being a research champion, like I said, with the benefits, it's taking away that mindset. I think we've been in the NHS for so long, but sometimes it's been that mindset of, this is how things always have been done. And sometimes challenging that can be perceived as a criticism regardless of how kind of tactfully it's approached. And to try and promote research and step away from that is really important, and that's why it's so important to have a supportive manager, because I think through my experience, things come better cascaded from top downwards than to try and get things across and upwards, especially if people don't want to engage, or they don't see it as part of their role, or they're too busy. So for me personally, having a ward manager, what a positive ward manager looks like is someone who leads by example, engages with staff, and has that conversation regularly about what studies have we got on. So they are aware of it as well. Having that open door policy for the open communication, where raising issues isn't going to, it's not met with criticism, it's not met with refusal, or it's that really positive mindset. And it does, you can't underestimate how much of a difference it makes, a positive difference, to have senior staff and managers on board in engaging with research to promote that in practice and to promote the delivery of studies and the benefits it is for patients as well. It's the good knowledge and awareness, like I said, with the things, but also encouraging staff to do the GCP training. I've just had a colleague of mine go for and say that she was interested in a research job, and signposted her to the GCP training through the NIHR website, and that's absolutely fantastic at looking for the role of research and what the expectations of staff are in research. And I think finally it's actively engaging in research projects, so everyone's involved, because it is everyone's responsibility. We are, best available evidence is changing constantly, and to be involved in that gives the most amazing satisfaction, and to say you've been involved in that creation. So thank you.
That's brilliant, Charlotte. Thank you. And we'll probably ask you a couple of questions after Sharon's finished. So can I introduce Sharron, please? Are you there, Sharron?
Sorry, hello. Excuse me.
Hi.
My voice is going, so I hope I still sound okay.
Do you want to just introduce yourself as well?
Yeah, so I'm Sharron. I'm unit manager at Chorley Dialysis unit. We are a nurse-led unit. So we do have quite a lot of autonomy here. So this is kind of a journey that we've recently had with research, but going back to some of the benefits of for the service, as Charlotte has clearly stated, from my point of view as a manager, I see research in a very positive light, and that is fed down through the team, because it not only is in alignment with our renal services and our commitment to improving our patient outcomes, it also paves the way for new treatments that are beneficial to a lot of patients on renal and in other areas, of course, where research takes place. It also supports staff, especially nurses, to adapt to and respond to changes in clinical practice in regards to treatments and changing future policies in what we do. And the fact that nurses are involved, again, gives a lot of autonomy to them. What advice would I give to other leaders wanting to become champions? Obviously, promote leadership from a leadership point of view. The way we do it in our unit at the moment, we have monthly meetings. Any sort of promotional activity within research is brought up there. The Nurse Champion for Research as a platform to stand on, and it is a safe place to deliver any future information about studies that we're doing. Again, encouraging staff engagement of the wider team for that research that needs to be done. So yeah, I mean, there are barriers to it as well. I mean, I suppose from Charlotte's point of view, you've already got a role, it's an additional role, there's a fear of additional workload that's put on you, and obviously that impacts on time. I do have a mantra of all the nurses who have linked nurse roles have a protected time period, and obviously if you can sync your quarterly meetings every year where you can have a meet up like this seminar with the champions to look and maybe cascade possible future research tracks that could go ahead. Some of the nurses lack confidence. Charlotte, you've obviously got extensive experience, and obviously some of the nurses don't, and they're quite fearful what research is, you know, what's it about. They may have studied it briefly at university before qualifying. Again, I encourage people to spend maybe a day shadowing the research team, getting involved, see what the role is, ask those questions, you know. So yeah, I really think that's the way you can get the team on board to make it a smoother process, especially like you say, with research being such a vital importance to moving patient treatment forward. So this little cycle that's in front of you here is a recent study that we had on our unit, and it was great. We reconnected with the research team. It came to the unit. We sort of re-established working relationships. We'd had them in the past, and it kind of drifted away for whatever reason. They came up to the unit, they saw how the unit ran, shared information with staff, future plans, aims and objectives, and then obviously engaged in our and delegated a staff member for our research champion, who really enjoys her role, and, you know, obviously engaging in the research studies. It allows us to identify who, what, when, nursing and their involvement in the study. We continue to engage through that process once they were going through the process of identifying the patient groups that would be in alignment for the study. And then there was obviously a need for clinical understanding on both parts, what the study was about, what was required. We also shared clinical skills and training with the research team, because the certain tests that we're doing at that time were very time bound and it had to be done in a proficient way. So again, that was a really close engagement with both research and clinical staff, which was good. And then obviously at the end of the study, it doesn't mean it's the end. It just means it goes quite for a little while, because they go to other areas to do the same research, or they're analysing the results of the research. And obviously just staying reconnected. So the outcome of that study is fed back to the people who have been involved in that study, whether that's something that's a change in practice or treatment at the end of it, or it wasn't proved to be successful, etc. So yeah, so we're kind of in the mid stages of that research at the moment, where I think all the data and everything's been collated, and it's a case of being processed, and we're anticipating some feedback in the not too distant future. So yeah, that's my little bit.
That's brilliant, Sharron. What study was it that
It was the complementary study.
right, and what
Yeah, where it was
was
the blood
looking at?
test that was required to be taken at set times throughout the dialysis process. And it was basically, from my understanding, is a level of immunity through those stages of dialysis. So do patients become at a more risk during that process in itself? And what can we do about it? So I think they may have done all the other units in the Northwest. I think there was about five of us in total. So that's quite a big study, I would have thought. So
Yeah, brilliant. And so
it was, sorry, it was yeah, I've got to give full credit to Sarah McLaughlin. She was absolutely brilliant. She was dead keen, and she learned a lot. And also Alex, who I've known for many years in the research team. Yeah, so it was good to see everybody again as well. Yeah, so
yeah, I think
like
it's really lovely.
We've been nurse led. I think, you know, once the team's on board, you just run with it, in my opinion. You know.
Yeah.
But yeah, my mantra is it paves the way to better treatment for everybody.
That's so great to hear from, you know, a manager who's supportive of the whole process and allowing your staff to actually, you know, deliver part of the study alongside the research team. I think it's an absolutely brilliant example. And so have you seen, and maybe both of you can answer this, but you know, what sort of benefits have you seen for your service or staff or patients, you know, in promoting research and having that, you know, really be part of your service?
Right. Well, for me, from my perspective, and I've witnessed it over years, is the Tora line locks for the catheters. Before this was brought into current practice, which it is now, before then, the risk ratio of line infections and patients having to be admitted to hospital, have line reinsertions and further sort of risks with issues of the functionality of the catheter. Since we've been using that after the research, I think it was Dr. Solomon who did it many years ago. It has been an absolute phenomenal breakthrough for dialysis patients and for nurses to be able to deliver really effective treatment. So yeah, I think that was one of the big studies I was involved with at Preston at the time. But yeah, that's what came out of it, and the whole sort of, you know, treatment itself in regards to reducing risk of infection and keeping patency of the lines, which is, you know, dialysis is life sustaining, so it's important. So that's one of them I will go from.
And I suppose, did you see any challenges with any of your clinical staff about, you know, getting involved in the study and what, you know, what was the champion's role and your own role to promote that and make sure that it's okay?
I think from our perspective back then, because they had a number of patients who you selected to be in that research program. With renal, people move about, the transient, so it's keeping on top of that individual where they're going with for the dialysis, communicating to the other units where they've gone that they're on that policy and that's what they should be following. That was one of the biggest things, keeping track of the patients when they were moving about. If they come to the same dialysis week after week after week, it's sort of uniform, isn't it? It's expected and it's implemented. But when patients are moved around, so yeah, I think it was a tight number of patients, and I think it was a long study. I think it was a 2-year study. Yeah. So it was just keeping that momentum and the tracking of the patients that was really hard for the clinicians, really.
Yeah. And like amongst the nursing team, was there any fear of, oh right, this is the research bit and this is the clinical bit?
I think for the nurses, I think when we were trialing the solutions for the line locks, there was a lot of apprehension that it wouldn't be as successful as anticipated, as in, would it become problematic for the dialysis itself? Would it cause problems in delivering of that? So yeah, there was a little bit of apprehension, but again, it was a smaller team back then than it is now. So there was a few people that were skeptical, but the clinicians then, they actually did, I think at one point, they did a presentation that we all went to, and it was the consultant who delivered it. So it was that kudos, if you will, that it's coming from somebody and being cast, again, the top down. So, yeah.
And then thinking about your role as a ward manager or unit manager, as a champion yourself and promoting other champions, do you see any barriers to setting that up and making it work? And, you know, what sort of things are they doing to help promote, and yourself helping to promote the study or other research or that sort of thing?
Yeah, I think sometimes it's being in the loop and going to the meetings when obviously time and everything always comes into question, doesn't it? But when the studies are being discussed and talked about, being present in the meetings when that happens, not just getting the information secondhand, so you don't quite get the full gist of what's going on. Again, we very rarely, unless it's purely dialysis linked, because we are an outpatients purely for dialysis, we don't really get involved in any of the other studies that may be used on inpatient studies. Sometimes we've had patients come back and said, oh, I'm now involved in a study after an admission to hospital. So that's sometimes we only get to know that way. It's like second hand. So yeah, it's almost like it needs to be advertised a little bit more. Whether that could be brought up at the sisters meeting in the renal unit, when we have our monthly sisters meetings, if research team maybe present there and just say, look, we're looking at this, you know, what's your thoughts on this, you know, is it relevant to your area, such a thing, you know. So
yeah, brilliant. All these ideas are good. Brilliant, thank you. And Charlotte, is there sort of an ideal place you think about raising that, you know, Sharon's just referred to it, but raising the awareness, communication, and what would you like to see from a manager or leader in overseeing research champions?
So I think the biggest thing from promoting it is that positivity and leading by example. And, you know, like Sharon said, speaking in the sisters meeting is amazing, but it's then, I think it's then important to take that, but what's, you know, the kind of feedback from that and bring that to kind of the daily clinical area. So bringing that into, you know, the daily handover and having mini teaching sessions from research champions with all the other staff, because as amazing, you know, as managers and things are at supporting and promoting it, the ones it's your kind of your band 5s and your 4s and your 3s who are actually seeing them patients day in, day out, and to have that confidence that actually I'm not doing something wrong because I'm being supported by this. So I think from, you know, an ideal kind of situation for a manager, you know, is having that time to meet, you know, not just with kind of the senior members of staff as well, but like Sharon said, but involving the research team, involving the research champions, and, you know, exploring altogether how best to promote that to the wider team. So like we have a daily huddle, but it's purely kind of make, you know, what's going on with the patients. But we do mini teaching sessions as well, where one or two staff members, when we have I think it's like 6 weekly team meetings, will do a mini teaching session. So bringing, you know, really kind of promoting research being brought into that and research studies. Sharon hit the nail right on the head earlier about that, her team having the delegated time to catch up and link in, which I know not every area is fortunate to have. And it should be counted. It's that CPD time. It's that development time. But, you know, I think from the kind of, I've only been with the team a year, but I think the achievements that we've achieved since I've started there, we've just had our 4th continuous gold star from the star audit, and I think a lot of that comes into it, that, you know, that it's that promotion, it's having that clear visibility from like our unit, that it's, you know, right on the board as you're going past, it's literally right opposite the staff doors. So yeah, it's definitely a joint effort, and having management engaged and having, you know, your staff on the ground level engaged as well. So everyone's like working collaboratively and everyone's got the same goal and focus.
That's brilliant. Thank you, Charlotte. And I hope you're not embarrassed by me saying this, Charlotte, but Charlotte was a student in the research department a while back, and I think being around the research staff really enabled you to get a very good grade for your dissertation.
I did. Yeah, I did. It was a research proposal on looking at the education, that whether the nursing education it should be combined with adult and mental health, and we had to set it out as an actual research proposal, and I hadn't got a clue on my chapter 3. And I walked out with 90% on my dissertation from and working in the research department was a massive contributing factor to that.
Well done. You got a lot of audience clapping there, so well done. Oh, we've got somebody got their hand up. Who's that? Feel free to speak. Or was it just an error? Because sometimes you think that's the clap. Okay, brilliant. Thank you so much, ladies. That was really, really interesting. So if we just stay around, because we would like you to be part of the communications of the rest of the presentations, if that's okay. So we're just going to move on to Nick now, who's going to do a little bit on how she set up research link staff in her organisation.
Thanks, Nicola. Hi, everyone. So I'm Deputy Director of Research Nursing at UHBW in Bristol, and we have recently implemented research link roles across the organisation. We launched it towards the end of last year. So I'm just going to sort of give you a few little things to perhaps consider if it's something that you want to do in your area, and things that have worked for us. Next slide, please. So basically, just a few sort of kind of top tips, really. So like I said, we implemented it across the organisation, but we did that as a whole research and development department. So we were able to do that. If you're responsible for one particular clinical area, you might want to just start small and just perhaps identify one area that you could perhaps pilot the research champion or research link role, just to sort of focus on one area first and think what that looks like. And that's the next point. You need to really consider what the role looks like. We created a role description, which we kindly had a description shared by a neighbouring trust who had already started to develop one. So we looked at that and then adapted it to our organisation, just so that we could outline the expectations and the responsibilities for those that were interested in the role, and they could see what it looked like. And also for managers as well, they could see what the expectations of the role were as well. So that was a really good first step for us. We've also given our research links badges. Everyone loves a badge. So that little logo there, that's the badge that our research links wear, just to kind of give them that identity as well and help them promote the role. The other thing is obviously really important to engage and link with the research delivery teams that perhaps cover your area, and also the research and development department or R&I department in your organisation, so that you can they can help update with resources, what's going on trust-wide, to help you be able to promote research in your area. And also think about some of the other people that it might be important to engage. So we engaged with obviously the directors of nursing, the matrons, the ward sisters, just to try and get the word out there. So it's just important to think about in your own areas, who are the really important people that need to know about the role. And then the next thing is really just taking really simple first steps. You don't want to try and do too much too soon, we found. Things like promoting research boards, having something visual in areas is a really good first step. Some of our research links are setting up journal clubs in their areas, just to start talking about research, making it a bit more of a discussion point. And also putting research on team meeting agendas. A lot of our areas are now framing their agendas for meetings around the 4 pillars of practice. So they're making sure that they cover all of those areas, which is great to get research on the agenda that way. So that would kind of be the sort of 4 things I'd say to start thinking about if this is something you want to do in your area. I saw in the chat there a few people wanting the role description. Yep, I'm happy to share that. That's no problem at all. Next slide. So I'm not going to go through all these slides because of in the interest of time, but yeah, that's just a little bit about the role description. That's a screenshot of the role description, but I'm happy to send the full description to anybody. Next slide. And this was all the engagement and advertising that we did in our areas, but you'll get copies of these slides, so I won't go through all this, but if anybody wants any more information, they can get in touch with me, that's fine. Next one. And then this is the programme that we've put together for our research links. As I said, it's on a bigger scale, but we run an introductory study day for them. They all get a badge and a manual, and then we have webinars every 2 months for them as well, with an educational element and an opportunity to share what they're doing. And then we just make sure they have regular contact with the teams. And I think that's the end of my slides. I think I'm handing back to Nichola.
Okay, brilliant. Thank you for that. Yeah, there's some really good key things there that we will send out this recording for everybody to catch up on, and appreciate that a few people missed the earlier part of the presentation. So we will send the recording out, but I don't want to miss out on the opportunity for us to start to talk to each other now. I'm sorry if some people have to leave. Bye. Thank you for attending. Just seeing in the chat there. So we were going to do this as a breakout room, but I think we're going to be doing it all together now, where we've got a bit of a Slido and we've got some QR codes, which we'd really like to get some of your feedback on. So Carl is going to lead this part of the meeting, but just to frame it, we want you to be thinking about as leaders how we might be able to set up champions, overseeing those improvements and showcase how they are making a difference with all of those categories there. And there will be a national, hopefully, community of practice on research champions generally, hopefully, in the next few months. So people might be able to dip into that to learn more. But yeah, so Carl, do you want to, are you sharing this, or Declan, do you want to go on to the next slide?
No, I am going to share it. So, can you hear me? I suppose is the first question.
Can hear you, yeah.
Yeah, excellent. So, leading on really nicely from the experiences everyone shared, and then the follow-on questions. What we want to know is, what do you think about these 3 questions? Really, what might it look like in your area? How can we help facilitate this better? So what I'm going to do is just take a couple of minutes just to think about each of them, and I'm going to then individually put up each of the Slidos. Don't worry about missing the QR code, because it will be on the slide, and there's also a link to just tap it into, go to slido.com, either on your mobile or on your computer, and you can put the number in. So there's 2 different ways of getting in, and what we want you to do is just put in as many times as you want what you think. Firstly, what are the barriers to setting up and supporting champions in your department or your area? So I will just share my screen. Excellent. If everyone's starting to see that people have started to join that now.
If anybody also wants to speak, they can raise their hand and make comments. Time seems to be a big one. Sharon's got it sorted though. Sharron might have to tell you all how she's able to give that protected time. In fact, how did you do that?
You mean give staff the protected time?
Yeah.
Well, because we have quite an extensive list of link nurse roles, it's a kind of a given that you support your colleagues to do that as part of their extended roles, and any other work that they may have to leave to other colleagues, especially in relation to dialysis. It's a given sort of agreement, an unwritten sort of rule that when somebody has to go to a link meeting, we cover for each other. I will come out of whatever I'm doing as a manager and say, right, such a body's going for a link nurse role, I'll step out, I'll support you, you go and do what you need to do. The staff then are reassured that there's still somebody there to step in, to keep the numbers as they need to be, to ensure the service continues to run. So yeah, where possible, if I know there's more than one person who's got a link nurse role that day, I can shuffle, arrange staff in numbers and facilitate that. So I guess people see it as a manager's role to facilitate that protected time. But yeah, we have quite a cohesive team. So they are very supportive of each other, which is very, very helpful. So yeah, but I have the powers that be, shall I say, to be able to say to somebody, you can just go and do what you need to do with your link nurse role. And obviously yourselves, if you link